Dr. Sharfstein, given the medicine that actually President Trump is being given, administered, and some of the symptoms, despite all of the changing ideas and actually changing accounts of what exactly is going on, what do you think you know about the president's update?
It's really hard to say. I mean, unfortunately, when you have a physician who's not really telling the whole story or really misleading people, which is what he was doing this weekend, it's really hard to say. If in fact he got steroids and the antibody treatment and remdesivir, his physicians were quite worried about him, and they really threw a lot of stuff at him because particularly steroids are for pretty severely affected individuals. So I think there's reason to be concerned until we really know that he's out of the woods, and it's probably going to be a few more days to know that for sure. I don't know if you can rely on what's being said about him, unfortunately.
I mean, there have been a number of people infected, we understand, at the same event at the White House. What has that experience taught us about how the virus moves?
Well, I think it's really important to realize that it looks like the White House was the center of the outbreak. The White House itself at a reception for the nominated judge for the Supreme Court. And there was a huge reception inside, and people were exposed. And, we know if you are close to people without masks in an indoor environment, that is the favorite environment for the virus to spread. And it looks like that's what happened. And there's so many people infected there. Pretty much everyone there really should be quarantining still because they could still get infected. This has not played itself out because there are likely to be waves of infection unless people really, cool it and quarantine themselves.
There are also, reports that the New York City mayor is trying to reverse a course to actually try and, close schools and close businesses because he's worried about a number of cases really surging. How does one handle New York City? Well,
it reflects that the virus is kind of surging quite a lot around the country. I think that having a targeted approach for certain neighborhoods can make sense, but they're going to have to watch really carefully to see if it's working. There's a lot of understanding in New York. I think what really has gotten the White House in trouble is that people didn't really think that the virus, the laws of the virus applied to them, that there was some sort of White House exception, which is obviously not true. But I think people in New York know how serious this can get, and I think it's quite possible they'll be able to get control of it.